In this tutorial, we're going to talk about exercise for lower back pain. We're going to focus on this slide on 3 muscles to target. Then we're going to cut to the gym. I'm going to talk quickly about 3 sort of components of exercises that help target these muscles. And then we're going to talk about 3 different exercises to be able to not only target the muscles, but that uses those 3 components so we can get the most out of them. So it's 3 muscles to target, 3 components, and then 3 exercises. So the muscles that we want to target are the obliques, glute medius, and QL. Now these aren't the only muscles to target because we want to be targeting the entire core. But what we generally find is that people will target the front of their torso, but they won't necessarily do the side. So they can hold a plank for a long time, but they can't necessarily hold a side plank for a long time, for example. So that would show there's some degree of imbalance within the core. So, as I've mentioned, the 3 muscles, obliques. Now, what I've got here on the diagrams, you've got what's called the lateral line. So this comes from anatomy trains. So it basically talks about the muscles that connect the entire side of the body. Now the obliques are this area in here, which is the side of the torso. If we were to look onto this one, it would be in this area here. And on this one, it's this area here. Obviously on both sides. Glute medius then starts to come down onto the hip here. So we're coming down onto the side of the hip here and here. And then we've got the QL, which you can see on this diagram, which goes from the pelvis up to the ribs and then down the vertebra there. So in this diagram, it would cover this gap here. This gap here. And then obviously underneath the obliques. So it's this side of the body that we're focusing, or the side of the body that we're focusing on. Now when we're doing the exercises, we will get, certainly from a side plank, we will get the entire lateral line working, which is essentially all up the side of the body, from the side of the neck, down the rib cage, obliques, QL, glute medius, vastus lateralis, down into the outside of the lower leg, where there's a few different muscles down there. So it will get all of them, but we're just going to focus on these 3 here. And what we're going to do next is we're going to talk about 3 components that we need to be able to apply to exercises. And then once we've covered those, we'll also be talking about 3 exercises in which we can use them within. And we'll do that 1 principle at a time and 1 exercise at a time. So it does progress in some respects quite naturally and logically through the components into the exercises. So as I've mentioned before, the muscles at the side of the body, the QL, glute medius and obliques, are very important for stabilizing the spine and helping minimize the risk of lower back pain. So what we're now going to do is look at a couple of exercises where we can start building these up. A lot of people may well, through doing exercises like sit-ups, crunches, or even the plank, will tend to have relatively strong, sort of, let's just call it the anterior aspect of the abdominal wall. But as soon as you ask them to go onto the side, it becomes a lot weaker. So we need to build these up. So we're going to use a couple of exercises. One is going to be the side plank, and we're going to do a kneeling version and then a full version. And then we're going to look at some alternative exercises that we can do up on our feet, which are great exercises for this area, but they involve using the whole body. So the first exercise is the side plank. So what we're going to do, very simple, we're going to come down, we're going to start on the knees. So we're going to start knees stacked, shoulders stacked on top of each other, elbow directly below the shoulder, head stays in line, and then we have a slight hinge of the hip, but then we bring up and forward into that position, maintaining the neutral spine position from the bottom here up to the top here. And then we would hold that position, and you'll feel the tension go glute medius, that we know is at the top of the hip, obliques, and then the QL, which is nice, tightly tucked in by the spine there. So those are the muscles that we are working. Now we would format that in a 10-second hold with a 5-second recovery, back up to a 10-second hold, and then back down 5 seconds, and then you can add another block onto that if you need to. So once you've built that up to 3 blocks of 10 seconds with 2 5-second breaks in between, you would then start looking at moving on to a full side plank. So what we would do for the full side plank is we would come into this position. So now feet are stacked, knees are stacked, hips are stacked, shoulders are stacked. And then from this position, we would lift up and forward, again holding, keeping the lower leg off the floor. A lot of people will tend to sort of rest their foot on the floor, but we lift the ankle and we hold this position. So we stack, stack, stack all the way down, holding this position. Again, if we've just done the kneeling side plank for 3 lots of 10 seconds, we may only be able to cope with 1 lot of 10 seconds of the full side plank. So we start there. Then we build it up 10 seconds, 5 seconds, 10 seconds. So we've done 2 blocks. And then again, we will build it up to 3 blocks. So we've then built from a kneeling side plank, 3 blocks of 10 seconds, all the way up to a full side plank, 3 blocks of 10 seconds. The second exercise, we're going to be on our feet. It is kind of a whole body exercise, but the main focus is again, QL, obliques, glute medius, glute minimus. So we're going to be using a kettlebell here. Now you don't need a kettlebell, you just need a rucksack, a suitcase, a weight. The exercise is called the suitcase carry. We're going to do it in a static position where we're just kind of going to be marching on the spot. Then we're going to do it moving. So what's going to happen, we're going to have the weight down by our side. In fact, I'm going to do it side on to start with because we want to be able to pick it up safely. Now, depending on the weight or how heavy the weight is, what we would do is we would start with it at the side. We would then hinge at the hip, come down, keeping the back in position, bend at the knees slightly, and then lift into position. Or you can do it from the front and you can lift with both hands. So same body position, lift with both hands and then go onto one side. So what's now happening, I'm holding it in my right hand. The left side here is holding me up because if it didn't, I would fall over that way. So this side is really working hard to keep me upright. So all I'm going to do is I'm going to stand in this position. Now it's key that we keep the arm away. We're not resting it on the body because then it goes away. So we don't get as much tension here. As soon as we come away, we get more tension. What I'm then going to do, just lift a leg, holding the position, and then changing. So again, you can see the weight shift that's going on, that's fine. But what we want to be doing is just changing the leg, because then we're changing and recreating how the hips move during walking. Not exactly, that's not the point. We just want to be able to feel the muscles working. So we would do a number of sets, 8, 10, whatever it needs to be. Then we would change sides, do exactly the same on the other side. So from here, it's up. You'll obviously notice that it's very different between each leg or how it feels, but again, it's working this opposite side to stop me collapsing forward. So that is, in some respects, sort of the first place to start with that exercise. Just get used to holding it, focus on keeping the arm away from the body, and just using that little weight shift to keep your balance, but you'll feel the opposite side working, and you'll feel it also working through the hips as you change the legs as well. The second one is just to take that and just move it into walking. So again, we will pick it up exactly the same way that I talked about, into that position, and then all we're going to do, if I walk from one side of the room to the other, bring my arm away from the body, stand up straight, head in line, and then I'm walking across. Try and walk as normally as you can, and then I'm going to swap sides. Obviously, you might have somewhere the way you can walk longer, but essentially we're keeping that whole body nice and tight and tensed all the way through. So those are the suitcase carries, which is going to again take the tension all into the obliques, the QL, and the glute medius. So to quickly summarise what we've talked about, we've gone through 4 exercises. Kneeling side plank up into a full side plank. Doing that in 3 blocks of 10 seconds with a 10-second recovery. Starting in the kneeling, build it up to 3, go into the full, and then again build that up to the 3. Now you can do at the same time the suitcase carry with the kettlebell, which is first of all starting in the standing position or in the stationary position, arm away from the body, and then up, and down, just doing it on the spot, just getting used to having the arm away from the body, and then the weight shift, and then the marching. And then moving on to the full suitcase carry, where you would walk along a corridor, across a room, whatever it needs to be. So those are the essentially 4 exercises that you can start using to build up the QL, the glute medius, and the obliques. So many thanks for watching this tutorial. My name is Chris from Christopher Holt Training, and I will speak to you in a future tutorial.